Hello everyone and welcome back. My name is Osevwe, DNP-PMHNP. Today we are talking about lemborexant, also known by the brand name Dayvigo. Before we get started, remember that this education is for learning purposes only. It does not replace medical advice, diagnosis, or treatment from your healthcare provider. Alright, let's talk about Dayvigo. We are here to understand the medication in a way that providers and students can actually use. No confusing sleep gymnastics. We're going to keep this simple. Just clear education with a little fun. Dayvigo is the brand name for lemborexant, a prescription medication used to treat insomnia in adults. Insomnia means difficulty falling asleep, difficulty staying asleep, waking up too early, or having sleep problems that affect your daytime functioning. Dayvigo belongs to a class called dual orexin receptor antagonists. That's a big phrase, so let's break it down for our clinical practice. Orexin is a brain chemical involved in wakefulness. It helps keep the brain awake, alert, and active throughout the day. Dayvigo blocks these receptors. In simple terms, Dayvigo helps quiet the brain's wakefulness system, so sleep can happen more naturally. It's like telling that wakefulness signal to go home. Think of the brain at night like a security guard who refuses to clock out. The brain wants to review tomorrow's schedule or an unpaid bill instead of sleeping. Dayvigo comes in and says, "Thank you for your service. Please go home now." It does not force sleep like a hammer. It reduces the signal that keeps you awake. Dayvigo is not a benzodiazepine. It is not Xanax, Ativan, or Valium. It also isn't a Z-drug like Ambien or a supplement like melatonin. It doesn't push the brain down through GABA. Instead, it works by blocking the stay-awake signal. It's more like taking your foot off the gas pedal. For your board exams, remember the distinction between insomnia and sleep apnea. Insomnia is a subjective complaint of sleep quality, while apnea is a physical obstruction. Dayvigo is used for adults with insomnia who have difficulty falling asleep, staying asleep, or feeling tired because their sleep is not restorative. A patient might say, "I'm tired, but my brain will not shut off." In this case study, Dayvigo helped reduce the sleep onset latency without next day sedation. Let's go a little deeper. Dayvigo blocks two orexin receptors, OX1 and OX2. That is why it is called a dual orexin receptor antagonist. Dual action is key. Think of orexin like the brain's daytime security alarm. Dayvigo helps turn down that alarm at night, so it stops yelling at you to plan to-do lists or replay conversations. Practice question: which mechanism of action describes lemborexant? A. G. ABAA enhancement. B. Melatonin receptor agonist. C. Dual orexin receptor antagonist. Think about it. The answer is C. Unlike Z-drugs or benzos, Dayvigo targets the orexin system to block wakefulness signaling. This is a common board exam topic for NP students. Dayvigo is a Schedule IV controlled substance. This means it has an accepted medical use, but there is still a potential for misuse. Take it only as prescribed. Do not share it. Do not sell it. Do not take extra doses. This is not a medication to experiment with or give to a cousin who can't sleep. That's dangerous practice. The common starting dose is 5 milligrams by mouth at bedtime. The dose may be increased to 10 milligrams based on how you respond and tolerate the medication. Always start low. Only take Dayvigo when you can stay in bed for at least 7 hours. More is not always better. It might just mean more next day grogginess and slow reaction time. Take it once a night, right before bedtime. Do not take it in the middle of the night, and definitely do not take it with alcohol. It's a bedtime-only medication. Taking Dayvigo soon after a heavy, high-fat meal can delay its effect. If it's not working fast enough, review the patient's dinner timing and content. Common side effects include sleepiness, headache, and sometimes abnormal dreams or nightmares. If a patient feels groggy the next day, they must tell their provider. Dayvigo should not be used in patients with narcolepsy. Orexin is already dysregulated there, and adding a blocker could be highly problematic for wake-sleep control. It can cause central nervous system depression. Avoid mixing it with alcohol benzodiazepines, or opioids. Alcohol plus sleep meds is a major safety risk you must teach. Watch out for complex sleep behaviors like sleepwalking or even sleep driving. These are dangerous and should be reported to the clinical team immediately. Monitor for worsening depression or new suicidal thoughts. If anyone is in immediate danger, remember the 988 crisis lifeline. Safety is our priority in NP practice. Dayvigo is processed through the liver, specifically the CYP3A pathway. Moderate liver impairment may require a lower dose. Your liver is a vital part of the treatment map. Medication should not be the only plan. Good sleep hygiene matters. Teach your patients consistent wake times, limiting caffeine, and keeping the bedroom cool and dark. Limit screens and use the bed for sleep. Medication opens the door to better sleep, but your habits help keep it open. This is a core part of patient education. Practice question 2. A patient takes Dayvigo and reports sleepwalking. What is the next step? A. Increase dose. B. Take with a high-fat meal. C. Discontinue and report. What's the best action? The answer is C. Complex sleep behaviors are serious safety concerns and require immediate clinical review. Never ignore these reports from your patients. Let's recap. Dayvigo is lemborexant for insomnia. It blocks wakefulness, it's not a benzo, watch for narcolepsy, and always educate on the 7-hour rule. Safe sleep is the goal. Thank you for watching. My name is Ben Osevwe. For support, text 832-991-6516. Join our mentorship family today at academy.rotationmatchnetwork.com. See you in the next lesson.